Well, if you were just joining us, we received new numbers tonight showing over 4.2 million people have now been kicked off of their health care plans. The administration and top Democrats have been blaming this on the insurance companies. And yesterday, some of the top insurance execs asked the White House for a little sit-down. Joining me now, Bob Laszewski. He's the president of Health Policy and Strategy Associates, and he liaisons with some insurance companies and has his finger on the pulse of that market. Bob, thank you for being here. And so what of it? I mean, what do you make of what is clearly emerging as the administration's defense to the cancellation of these plans, which is insurance companies are bad, they do what they're going to do, and that includes canceling people. They do it all the time. They did it before Obamacare. They're going to do it after Obamacare. Don't look at us.
Does anyone in America think that the insurance industry would have canceled 4.2 million customers on virtually the same day if it weren't for Obamacare? And by the way, your 4.2 million number is an interesting one. That's what the count is up to. It's going to get much higher than that. We're going to have these cancellations going into 2014.
How high do you think it's going to go?
Oh, I think about 80% of the people in the individual health insurance market will ultimately lose their insurance because of this. The grandfather provisions, so-called grandfather provisions the Obama administration wrote are so stringent, very, very few health insurance policies are going to survive.
And so when you hear Kathleen Sebelius and President Obama say, look, it's the insurance company, and we said you could keep your policy if the insurance company didn't change that policy, is that false? I mean, should they have known that their own regulations were going to lead to the insurance companies doing exactly that?
They absolutely knew that their regulations were going to lead to the insurance companies doing that. And the reason they knew that is the insurance companies during the regulation comment period sent very specific letters as part of the official comment in the regulations before they were issued saying this was going to happen.
So when Kathleen Sebelius in the summer after Obamacare became law offered these regulations in the Federal Register, which we've been holding, which basically eliminated the grandfathering for all intents and purposes. Right. I mean, they said that your plan would be grandfathered in thanks to these. It wasn't. So the insurance companies spoke out publicly and said, hold on, Ms. Sebelius, hold on, President Obama. We want you to know what you are doing with this is basically eliminating the individual insurance market.
It's in the record. It's in the record. You know, this administration, when the computer system crashed, they immediately blamed the subcontractors. Now, when millions of policy cancellations are going out, it's the insurance industry. I mean, when is this administration going to take responsibility for the rollout of Obamacare? You know, I really have to wonder here, given the way this cancellation fiasco has been handled, given the way that they've rolled out the computer systems, you know, they're messing with 1/7 of the economy here with Obamacare. They're messing with millions of people's health insurance. You know, if they believe these things, if they actually believe them, then they do not understand how the health insurance market works. And then what are they fooling around with it for?
Well, and there needs to be accountability for that as well, because the promise was made, and it was made repeatedly.
Yeah.
Here's my other question to you. On this theory that the administration needs those people. It needs the 10 to 15 million people in the individual market to make Obamacare work. And the possibility that they knew that they were going to get canceled and they were just fine with that because they needed those people to get off of their private plans, go to the exchange and sign up that way. Is that possible in your mind?
Yeah, it's possible. You get back to why are they doing all this? Do they want everybody in the exchanges because they want everybody in the same utopian health care plan? People have had all these choices before, but now you're going to have gold, silver, bronze. Are they doing it because the people are healthy? Which, by the way, you know, if these people are all healthy, why would the insurance companies be canceling them?
That's right.
Yeah, exactly. This whole thing just doesn't hold together.
Will it work? Whether it was the plan or not, if the people were not going to go to healthcare.gov and sign up, but now these people who have all been kicked off their plans, the 4.2 million tonight, that now they basically have to. So is this regulation by Kathleen Sebelius going to basically save Obamacare at the expense of all those people in the individual market?
Well, no, because the insurance companies already had these people, and they were already part of their individual health insurance pool, if you will. Keeping them just keeps you where you were. The question now is, are we going to get enough healthy people signing up to in the additional pool, or the new pool, if you will, to pay the claims? You know, there's a front page Wall Street Journal article today that said, at least in the beginning, you know, we're getting the older, sicker people, which is what we thought, which makes sense because they're the only ones that'll stay up all night and fool around with that system, the computer system.
Well, it won't do them any good to
that's
stay up
the
all
real
night
question.
now because it's shut down from 1 a.m. to 5 a.m. every night while they try to fix it.
They probably help some people there.
Bob, thank you.
Thank you, Megan.